you know, that N-acetylcysteine is a natural product, and that's the only thing I can tell you.
What was it again, please?
It's one of the studies that they're doing now that she just mentioned. It's called N-acetylcysteine. And they use it in Europe all the time for lung problems. They have for years and years and years.
It's not a drug, it's an antioxidant.
You just get it over the counter.
That's what I was wondering is, are other countries farther advanced? A lot of times with FDA and all, we don't seem to get it here in the U.S., but other countries are doing quite a bit.
Yeah, pirfenidone, one of the trials I was going to talk about, they've already approved that in Europe and Japan, India. I'm trying to remember. Here's the country. So, yeah,
So
there
there's
are
a lot of
drugs.
stuff going on.
Not a lot, but pirfenidone is the big one that's been approved, and that's the second trial that we'll be conducting at our centers. That Laura will talk about more.
I'm using homeopathic remedies,
Okay.
and they have been marvelous. I think you have to have the right doctor. Mine is a medical doctor who specializes in homeopathy, and I'm just so much better than I was. That it's worth everything to do it.
That's great. I mean, you can, that's kind of what you're on.
Yeah.
Yeah.
Yeah, give us his name and number.
That's great. Anything else? Okay, Mari will talk to you about the trials.
So if you have some more questions still about these trials that you want to look at a slower pace, you can just go to the internet and type in our website, which is VID00003. Again, click on the clinical trials. When we have the ones that are in process now, they'll be on here. So we look down past the COPD down to here. So she just spoke about the Panther. So if you had questions about that, you could go to that one. It has all tells you all about it right there and what you can do. They also have it as part of the IPF Net, which is an NIH-sponsored group in which we are part. And they so they have tell you some different things. And then the consent form is right here on the bottom. So you could look at the consent form and say, and read it at your leisure and decide if that's something that you would be interested in. So then just going back again, the genetics one is you can go right there, and I think there's a consent form there. If you haven't done the genetics, there's a consent form, a pedigree form, our phone number, and you can just call our office and talk to Molly about scheduling a blood draw.
What's the website address again?
It's Utah Lung Health. It's at the bottom of if you want to see on your agenda, it's on the first website listed on the websites.
Utah Lung Health?
Yes, UtahLungHealth.org. So that will keep you in, and so it has the consent form there. The recap is that's what Anita was talking about. She's in that study. It's closed to any new people. It's been how many weeks now, Michelle? It's like
156.
They've been on the drug for 156 weeks so far. And so I'm sure Anita would be happy to talk to more people who had any questions about how she tolerates pirfenidone and about that. And then Center Course studies. I don't see anyone here who's currently. Oh, yeah, I did that Center Course study, and that was. We aren't enrolling anymore right now, and it's closing shortly. The cell gene study. It is open. It has 3 arms to it. 2 arms have been closed. They did that. You are on active drug, but let me just pull that up. As it's testing a medication called June kinase. They call it in short the JUMP inhibitor, And it's they block the scarring process. They believe that prevents your lungs from working properly. And the drug is CC930. It's in its phase 2 trial. They have 3 arms. I'll pull up the consent form for you. We only will be enrolling maybe, hopefully enrolling 2 people there. It's a very stringent trial, so if you've had any kind of skin cancer in the last 5 years, they won't take you. But it's interesting, and they may be having a phase 3 trial, which will probably be a placebo-controlled trial. This one, it does have a 4-week placebo arm in it, but after you've run the possibly a placebo for 4 weeks, and you've done active drug for a year, 48 weeks. And also, some of the other things you have to, in all the trials, you have to pass blood tests, make sure you have good liver function, that your kidneys are working well. And if you have had a current infection, you have to be delayed for a while before you can be enrolled. They don't want to have that muddy the waters of where you are at your baseline. So they want to make sure that you're well and things are looking good to be part of the trial. Does anyone else want more information? I have some consent forms printed out for the Celgene trial here. You can take some home, or you can look it up and read it on our internet site. It's they reopened the last time. They've done the 2 lower dosages, and then they're hoping to open up next time in September. So we would hope to open screening again in September for Celgene and have a few people in there, probably 2 or 3 at the most. And then on from there, the ones that Molly told you about, the next big one, and which will be the preventative trial, which is called the Ascend trial. So you can go to their website, www.ascend.com, I think, or ascendtrial.com, I think. Let's see what that works. Anyway, we're still, while that's coming up, we're still hashing out things between the company and everything, and hopefully they get all the things done. But anyway, you can go to the Ascend trial, ascendtrial.com. I did not put that on the websites there, so if you're interested in that, you can look at it there, and it will tell you, just tells you learn about the trial, find out about eligibility. You can click on that, and it tells you where you can go, and you, of course, we will be doing it. But here's the eligibility questionnaire for the Ascend trial. I clicked on that. So you come up. Okay, and it says age. You've been diagnosed as your forced vital capacity between 50 and 90. If you're a smoker, are you willing to quit? Actually, that's a very abbreviated list. They have a lot more that they're interested in besides that. But basically, if you are interested in that, you have to have the disease less than 48 months. So that's a limiting factor for some people. Yes?
Lori, doesn't that mean you have to be diagnosed?
Diagnosed, yeah. That is another question that there are. It's a little waffly right now because they're trying to decide. Some of the people are saying it's from when you had symptoms in this trial, but which could be years for some people. So they're having another conference call to identify, and I'm pretty sure they'll stick with 48 months from being diagnosed, which, and if you had a lung biopsy, that would be the date of your lung biopsy, or the date of your high-res CT if you just had that done, where they clinically told you that you had IPF. So that would be 48 months from that. So time frame is usually the big limiting factor for a lot of people. And the other things, consent, an approved consent form for you to look at on that one, and I can't let you look at it until it's approved. So, any questions? We think we'll have 15 people. We'll probably have to have 15 people on that trial. So, any other questions about trials or yes?
With so many trials out there, how does the University of Utah determine what ones are going to be involved?
Sometimes they're already assigned, like they're just very localized trials, very small trials. A lot of those, that whole list, like John Hopkins, that's a one-center trial. So if you wanted to participate in that trial, you just have to go to their location. So usually, Mary Beth gets contacted and she reads through the protocols. They send what they call a site survey, and they see if we have enough patients. But yes.
Isn't there an NIH site on clinical trials where you can find out who's doing what where? I thought maybe
that's the clinicaltrials.gov. They do that.
Yeah.
Clinical trials. You can find, and that says exactly where and who. So they usually come after, who they want. So she gets a lot of offers, and most of them, sometimes if they think the risks are too much, or if, there's 1,000 factors, and you have to look at all of them. It's like, and it has to be approved by our IRB. All these have been approved on clinicaltrials.gov by IRB someplace. They have the different, and there actually is a new movement where they want to just have a few national IRBs so that they would do away somewhat with local IRBs, and so they wouldn't have to renegotiate things with each different university, and that's why it takes so much time, is because, we may have we have a very strict regimen here, and just getting ours through, we may, our IRB, our specialists, we have on your IRB, if you're not familiar, it's a group of some of the top scientists in the field, people who are top pulmonologists, and our local, we have lay people, we have people representing different people in the population for all these studies that go on at the universities. And all of these people have to read the protocol, and then they have to decide, would this put people at too much risk? Or is this even going to be an effective question that they're answering? Because sometimes if our IRB actually, we were doing a one Artemis study, and our IRB came up and pointed out to the people, they said, if you get such and such data, they were able, I was impressed, but our people picked it up before the national people did, that they were not going to get a positive study because some of the bases they were asking were not, they weren't asking the question, or the data they were collecting would not provide the answers that they wanted. And so it was, it's important that everybody takes a look at it. And that's a long way of saying we don't do everything, because people have ideas and not all of them are good. And it takes a lot of people to look at it, and some people see some things and some people don't. So it's good to have a lot of eyes on it. And it takes a lot of time to look at everything, and